Welcome to this week's edition of the Wheels and Deals Community Spotlight, brought to you by Wheels and Deals of Pomeroy and the Meigs Independent Press.
This is Carrie Rose with Meigs Independent Press, here again with Wheels and Deals Community Spotlight here in their beautiful showroom in Pomeroy, Ohio. And this week I have with me Reggie Robinson with Health Recovery Services. Now, if you've been anywhere around any of the schools or anything, you know Rockin' Reggie because you've been everywhere. And you have been a part of festivals and doing all kinds of things, but you work with Health Recovery Services. So tell us a little bit about what you do and what Health Recovery Services offers.
Well, I actually have a day job.
Yeah,
and
you do.
That is as community coordinator with Health Recovery Services, and that means I work in the prevention division with Brian Howard, who he had on last week. And what we do is we provide evidence-based programming for the entire community. We focus in schools a lot, but we also have adult evidence-based programming, and it's designed to give people skills to refuse alcohol and other drug abuse, and also other unhealthy behaviors. We kind of cut our teeth in the alcohol and drug prevention, but we have other programming. We have suicide prevention coalition that we're a part of. We have actually programs on internet safety. We have programs on avoiding dating violence. And so we have a lot of programs that work on building social emotional skills for mainly for young people, working on communication, managing anxiety, lots of different things that are going to better equip them to live healthy lifestyles.
Now, explain evidence-based for somebody that doesn't necessarily understand what that means.
Evidence-based means that, you know, these are times when resources are tight and the funding is tight, and so the people who provide funding for these things, they want to make sure that the programs work, that they're effective. So evidence-based means that they've been tested with a wide segment of the population and been proven effective through university studies, through longitudinal studies, things like that, following people for a number of years. And so we're not trying out there with unproven approaches. These are proven approaches. We know that they work.
And you offer all kinds of different things for different people in students, and so tell us a little bit more about some of those programs.
Well, we have a number of programs. What we do is, again, we use evidence-based programming. A lot of that evidence-based programming comes, we basically purchase a curriculum. We get trained in those program approaches, and so we personalize it because we're in southeastern Ohio, so the things that might work in an urban area don't work as well here, so we work with the developers to make our basically adapt our programs to our population here, and we have just a variety of them. We have one called Too Good for Drugs, as you know, just to give you an example, and it's 10 sessions, and in those 10 sessions we usually go into a classroom once a week. As a matter of fact, I'm just coming from another county, came straight here from another county, and we were there all day with 8th graders and 7th graders, kind of each period giving them this information. Today we were talking about opiates. You know, this state is one of the hardest hit as far as fatal opioid overdoses. As a matter of fact, Ohio is second in the country, behind only West Virginia as far as fatal overdoses. So we believe starting early, starting with those young people is the way to go. You know, if we can keep them from ever using this stuff, obviously they'll never become addicted and never overdose. So that's just one of our programs, and we have a number of them. Another one's called Life Skills, and so we have, like I said, a bunch of different curricula that are evidence-based that we go into the schools with, and of course we have, programming for. We actually do in-service training for the teachers, and kind of teach them, some of the evidence-based programming that we're doing. Also, we have a cultural competency in service that we can come in and do, one on suicide prevention, kind of recognizing the signs of suicide. So just a lot of education that we do out in the community.
And you provide this resource, and then of course now you also provide individuals.
Yes.
So if somebody needs help in different issues, there's different things that you can help with.
Absolutely. Yeah, we have our office, which is on Mulberry, up on Mulberry, and we have clinicians there who provide counseling. Now that's different from what Brian and I do. We're on the prevention side of it. But once someone does develop and is diagnosed with an addiction issue, with a substance use disorder, then that requires a licensed counselor. And we've got licensed counselors who we're so proud of. They're Meigs County locals, and many of them have been serving this area for decades. And so they're known in the community. They're a part of the community. And what they do is, again, they use evidence-based best practices, which are a little different from what we do in prevention, but there are therapies that are based on evidence, and they're designed and proven to help people to recover. You know, we've got a problem in our area, and we're not alone, but again, our area is kind of harder hit, more disproportionately than other areas. And so, you know, our people really are struggling. And with COVID-19, it's only gotten worse, as you could probably imagine. There's a lot of stress, a lot of anxiety out there, I don't have to tell you. And in some cases, people are turning increasingly to alcohol and other drugs. Just as a matter of fact, the first month of the pandemic, alcohol sales went up 55% in 1 month. And
that was one of the things that I guess, wherever you want to stand on the political spectrum, but that was one of the things that was not shut down.
No.
It was the alcohol sales.
Yeah.
And you see that now we're also going into the holidays. And we're going into the holidays, and there's a lot of anxiety right now about what's going on with COVID. Is there going to be a shutdown? Is there going to be, what's happening? And so you're adding to that stress. And if you already have issues dealing with the stress in your life anyway, it just makes it all the worse.
Yes.
It's worse.
Yes, people are struggling, and you know, our clients are struggling. We never shut down during this whole thing. We kept our offices open. Now, of course, we had to be smart. And you know, we took precautions. We have social distancing therapy. You know, we have offices that were specially retrofitted so that our clinicians could, you know, be in contact with their clients. But you know, again, observing all the public health precautions. And we of course instituted telehealth. But some of our clients said, "No, I need to see you face to face. Things are just so tough." You know, there's just no substitute for that. And so you know, we didn't close our doors, and every client that wanted to come in and see a therapist in person has been able to do that.
Wow.
Yeah. And we've stepped up the ways that they can access us. Like I said, telehealth is happening now. We even initiated a new program, just started last week, something called Tuesday Night Live. It's a Zoom call-in that actually I'm hosting. I'm a certified peer recovery supporter.
Okay.
And so I host it 6 o'clock every Tuesday. It's going on throughout the holidays, a place for people to check in. People who need just some support or want to provide support to others. A lot of people don't know this about Rockin, Reggie, but I'm a person in long-term recovery myself.
Oh, wow.
It's been over 30 years that I've dealt with my own substance use disorder successfully. And all that time I've not had a relapse. I've just been incredibly blessed and supported.
Wow.
And so I want to kind of share that with others. And so I got trained as a peer recovery supporter, and it's another way for me to give back to others.
And congratulations on that.
Thank you.
Because that is a big deal. If you've not had family that's ever had that issue, or you've not known someone personally that has had that, I had a great uncle that I remember when he always struggled with alcoholism. And I remember when he came one day to my grandmother's house and he started crying. Oh, wow. And he was one of those really tough, World War II vets. And he pulled that coin out of his pocket that he had been sober for so many days. And I don't remember how long it had been, but he was so proud to show her that. And that each time that he came after that, he had more to show her. And she was so proud of him for doing that. You have to, first of all, you have to support your family when they're in recovery.
Sure.
And you have to have that support system.
It's so important.
If you don't have family to support you, if you don't have those friends, because maybe your friends are in addiction and maybe they're struggling with it too, this is a place that they can go to get that support.
Absolutely.
And that's something that you can offer because you've been there.
Yes, absolutely. And you know, one of the reasons I'm being so forward with this now, you haven't always heard Rockin' Reggie talk about this, not that I'm ashamed, but it's really time to get rid of the stigma. There's so much stigma and so much, you know, misunderstanding and so many myths about people with substance use disorders. It's time, that doesn't help. And as a matter of fact, it hurts because a lot of people don't come forward for help who really should because of that stigma. And so, you know, it's just time to get it out of the shadows and really deal with it as the disease that it is, just like cancer, just like diabetes.
And so if you have issues, if you're struggling right now, or maybe you're a family member that is dealing with a loved one that is struggling, there's help here. I want to stress that there is help right here. You don't have to go off into some other city, you know, Columbus or Cincinnati or someplace else. There's Meigs Countyans right here, your friends and neighbors that are ready, willing, and able to help you walk through this. They're help you go through this journey. And maybe today you're deciding, maybe you're tired. Maybe you're tired of the struggle that addiction is for you, that you're tired of that day-to-day, minute-to-minute battle. There's help. HRS.org.
Yep.
And, you know, give them a call. We're going to have all that in the post. We'll have all that information in there, your link to the website and everything. But these are good people that are ready, willing, and able to help you. And I really want to stress that because I've known him for a while, and I know the organization, and I know that they really do care. These are people that really, truly care. And, you know, this is a time of giving. This is the season of redemption and forgiveness and compassion. And if you know somebody that maybe needs that, maybe they just don't know where to go. Share that. That's why we're doing what we're doing. This isn't about just highlighting different things and doing different things, and it's not just, you know, Wheels and Deals is working on, yes, they want your business, but this is also about changing our community and impacting our community. And right now we have real issues here with drugs. We have people that are hurting. We have people that are generationally hurting, and we've got children that are hurting. Let's change that. Let's change the narrative. Let's turn a negative into a positive, and let's get bigger. Let's get bigger in our thinking. Let's get bigger in what we're doing. And, you know, the coalition, you're with the Drug Prevention Coalition.
Yes, Meigs County Community Prevention Coalition, yes.
And I bet you could use some help.
Oh, absolutely.
I'll bet you need volunteers.
Yes, yes.
So how could somebody help out with that?
Again, they can go to hrs.org, or they can look up the Meigs County Community Prevention Coalition on Facebook. There's a Facebook page. We meet the fourth Wednesday of each month at noon. We meet virtually, so it's a Zoom meeting. And you said something so important. People are struggling, but the thing is, you need to realize you're not alone. You know, there are people right here who can help you. All you have to do is reach out, hrs.org. Again, you can call our office, 992-5277. And there's lots of ways to get in touch with us. We will try to meet with you when you can. I know people work and what have you, so, you know, our clinicians are really great about meeting you where you are and, you know, providing the best services that they are absolutely able to do. But again, the most important message, you're not alone. You don't have to do this alone. There are people out there to help you.
And people that care.
Yes.
These are not people that, and I can say that because I know a lot of the people that work there, and I worked there at one point briefly in my career, but I know that they care. They're not just there for a paycheck. No. Believe me, they're not. So is there anything else that you want to add? Is there anything else that you would like to put in there, or anything else we missed?
No, I would just like to thank you for this time. Again, remember Tuesday Night Live every Tuesday at 6 o'clock. Oh, one more thing. Tuesday night, part of Tuesday Night Live, we have an extra on New Year's Eve. There's going to be New Year's Rockin' Eve with Rockin' Reggie starting at 9. So that'll be a Thursday night edition to the Tuesday Night Live. And you can find it on Facebook. Just do a Facebook search for Tuesday Night Live. The event should come up. And there's a Zoom link right in the event. And again, every Tuesday at 6, with the exception of New Year's Eve, New Year's Rockin' Eve from 9 to 1 with Rockin' and Reggie. We're going to count down until 2021. Isn't that exciting?
That is exciting. I think everybody's ready for 2021.
Yes.
And we're hoping and praying for good things and good blessings. And again, I want to stress, you do not have to walk through addiction alone. You do not have to walk through having a loved one that is struggling with this. There are resources here. There are people right here in Meigs County, up on Mulberry Heights, right here in
Yes.
Pomeroy, and we'll have all that information in there. And again, thank you so much for this, and thank you for sharing your story, and thank you for all the years you've dedicated to our youth, because you've really been an impact on youth in this county for a long time.
It's the most fun thing that I do.
It is amazing, though, what you're able to do.
Yeah, about 30 years I've been doing this. And thank you so much for this and for all that you do for our community. We really appreciate you.
Well, thank you. And again, I want to thank Wheels and Deals for sponsoring Community Spotlight and making this kind of community information available. And we'll be back again next week with something. Sometimes it's entertaining, sometimes it's informative. We never know what it's going to be, but we can't wait to be back with you again next week and share something else right here in Meigs County, of Meigs Countyans helping Meigs Countyans, and just, you know, we have a great place to live here. And there are bad things that happen, but there are good people here that are ready to step in when bad things happen. And that's one of the things that Health Recovery Services does. So thank you. And again, this is Carrie Rose, Meigs Independent Press.
This week's Community Spotlight is brought to you by Wheels and Deals of Pomeroy and the Meigs Independent Press.